So it's really important in this long slog against COVID-19 that we celebrate the wins when they come. The third wave is behind us, vaccination numbers are ticking up, and the world is starting to reopen for us once again as global travel restrictions ease. Now, over 1,000 new infections and 59 deaths, sadly, have been recorded in the last 24 hours, but it's way off where we were in July. A key part of those numbers is the positivity rate, and that's the percentage of tests done that show a COVID positive result, and that is down at around 3.2%. Let's discuss this now with Dr. Ridhwaan Suliman, Senior Researcher at the CSIR. Doctor, thank you very much for joining us. You know, we have come such a long way since, I think it was the 3rd of July, when you posted that graph that just shocked all of us. It was of Gauteng's spike, but it was practically vertical, the growth in the COVID-19 numbers for Gauteng. I want us to actually bring it up quickly while we chat, because that graph, I think, just did the rounds everywhere, because everyone was absolutely shocked. That was from July this year, and I remember you tweeting that saying, I don't know when this is going to turn around. And that was the big scary thing at that point. It was going up and up and up. What for you are the vital lessons that we can now draw from the third wave now that we're finally through it?
Good evening, Sally. Indeed, that was quite a scary period in which we were reporting a high number of infections, particularly in the populous province of Gauteng. And at that point, the Delta variant, which still is dominant, was really running rampant at the time. Fortunately, we have come through the third wave. All of the indicators are trending downwards, and we're in a much more promising space right now. Unfortunately, there have been a number of deaths during this period, a number of hospitalizations, and a number of people infected in that period. I think it has been a devastating period. I think we certainly learned a few things, and one is that when we had a new variant that became dominant, the Delta variant, it just overtook the previously dominant Beta variant and spread really widely with its increased transmissibility. And at that point, hospitals started to become overwhelmed, and following that trend, we did see a number of deaths being reported. I think maybe just to point out is that in this third wave, we saw an increase starting in the inland provinces of probably Northern Cape and Free State initially, and then Gauteng, and then spreading further outwards. Possibly maybe a take-home message is if and when we do see another resurgence occurring, it will start in one or other province, and we may possibly can try and be more proactive in containing that increase as soon as we start seeing that.
That's an important lesson, that we need to perhaps act a little quicker. You know, when that graph came out in July, I think our positivity rate was almost up to 30%, and it's now down to 3.2%. Just explain why the positivity rate is something we really have to keep an eye on as well.
Yeah, so because of our testing strategy, one in which we don't go out and do random mass testing, but testing is done by people presenting for testing after either showing symptoms or coming into contact with a positive case. The number of confirmed cases or reported cases is really also dependent on the testing that we do. So we do need to look at both the test positivity rate as well as the number of reported cases in combination. And because of that testing strategy, that test positivity rate really is a leading indicator to tell where we're at in the epidemiological trajectory. As you just indicated, we have come down quite significantly. Just looking at the latest numbers, the current 7-day average test positivity rate is down to 3.5%, which is the lowest it's been since it reached this point just before the first wave back in May 2020. So it is really good news, and it is something I think we can be quite proud of right now. The reason for that low test positivity rate is a combination of two factors. One is over the past 7 days, test has actually increased by 9% compared to the previous 7-day cycle, but more so the number of positive tests or the number of confirmed cases has decreased by more than 33% week on week. So that's really driving down that test positivity rate right now.
We're going to bring up just the latest stats because we want to see what's happening. But of course, as you say, we are through the worst, but we have to remain ever vigilant. But I want to ask you, I know that you said that the Delta variant really threw out any modelling, and even modellers such as yourself are going, when is this going to end? But as we look at where we are now, and we're in a good place in terms of the virus, we have a lot of challenges if we want to try and minimise the fourth wave. We're hoping to increase the rate of jabs, for example. We hope that people observe what they need to in terms of social distancing. Are you even able to predict if and when a fourth wave is going to hit, when it might hit, and how bad it might be?
It's difficult to predict all of those accurately just due to a number of variables that come into play. I think factors such as the actual seroprevalence rate or the number of people who've been infected currently and have immunity at this point. We're still waiting for actual figures of that. It's likely quite high at this point. We also don't quite know what the response to the easing of the restrictions as well as the response to non-pharmaceutical interventions may be going forward and as we move into level 1 and towards the end of the year. But I think the most unknown variable remains how the virus may mutate and evolve, and whether any variants replace the currently dominant Delta variant and become dominant in the country. And I think no one can really predict that. And I think based on that, what we really need to do to try and prevent that is minimize the transmission of the virus. And by doing so, we minimize opportunities for the virus to replicate and minimize opportunities for the virus to mutate. And I think that should be the number one proactive measure which we can try and do during this period while case numbers are low. And to do that, we do need to try and be more vigilant and increase our surveillance and monitoring while the numbers are manageable.